An allergy is an adverse reaction by the body to a particular food or substance in the environment. Most substances that cause allergies are harmless to most people and will have no effect on those who are not allergic. Any substance that triggers an allergic reaction is known as an allergen. Common allergens include pollen, latex, nuts, eggs, and shellfish. Allergies develop when the body's immune system mistakenly identifies an allergen as a threat, similar to an infection. In response, the body produces antibodies to fight it off, creating what's known as an immune response. The next time the person comes into contact with the same allergen, the body recognizes it and produces more antibodies. This triggers the release of chemicals such as histamines, which lead to the symptoms of an allergic reaction. Common allergic conditions include asthma, eczema, and hay fever. Symptoms can vary depending on how the allergen enters the body, and it may include sneezing, wheezing, coughing, and skin rashes. For example, breathing in pollen may affect the airways, while contact with certain substances may cause skin irritation. Some allergic reactions can become more severe and lead to anaphylaxis. Anaphylaxis is a serious life-threatening condition that affects the whole body, particularly the respiratory and circulatory system. Allergens can enter the body through ingestion, inhalation, skin contact, or injection, such as a bee sting. It is important to understand that not all reactions are allergies. Reactions can also be classified as sensitivities or intolerance. A sensitivity is an exaggerated response to a substance that would normally cause no reaction. For example, caffeine may cause palpitations or trembling in some individuals, even in small amounts. An intolerance, on the other hand, does not involve the immune system. It occurs when the body has difficulty processing a substance such as lactose or gluten, leading to symptoms like bloating, diarrhea, or abdominal discomfort. Some people may tolerate small amounts, while others may experience more severe symptoms that can last for several days. In contrast, a true food allergy can trigger a reaction, even with very small amounts of the allergen. Management of sensitivities and intolerances usually involve avoiding the trigger and allowing the symptoms to settle. However, severe allergic reactions require immediate treatment. In cases of anaphylaxis, adrenaline auto-injectors are used to deliver a pre-measured dose of adrenaline into the muscle. This helps reduce the severity of the reaction and can be a life-saving treatment while waiting for the emergency services to arrive. Signs and symptoms of anaphylaxis can include itchy skin or a raised red rash, swelling of the eyes, lips, hands or feet, feeling lightheaded or faint, and narrowing of the airways, which can cause wheezing and breathing difficulties. Other symptoms may include abdominal pain, nausea, vomiting, and in severe cases, collapse or loss of consciousness. Anaphylaxis must always be treated as a medical emergency. If you suspect someone is experiencing anaphylaxis, you should immediately dial 999 and request an ambulance. Adrenaline auto-injectors are prescribed by a doctor and are not available over the counter, meaning that a person will have their own prescribed device. Many individuals are advised to carry 2 auto-injectors, as a second dose may be required if symptoms do not improve after 5 to 15 minutes. All auto-injectors are single-dose devices. If a second dose is administered, this is important to inform the emergency services so they're aware of the amount of adrenaline that's been given. There are several types of treatments available to the public, and while their design may vary, they all perform the same life-saving function. It is important to be familiar with the specific device prescribed. The EpiPen is one of the most commonly used devices, and it's available as a standard and a junior version. Instructions are printed on the device. The blue cap indicates the safety cap, which must be removed before use. The injector is then pushed firmly into the outer thigh, which can be done through clothing, providing there are no thick seams or objects in the pockets. Once activated, it should be held in place for around 3 seconds before being removed. The Jext auto-injector is similar in function, but has some visual indicators. It includes a window showing whether the device has been used, as well as a window to check the medication. The liquid should be clear and colourless. If it appears discoloured, the device should not be used and should be replaced. To use, remove the yellow cap and press the black end firmly against the thigh and hold it in place for around 10 seconds. Afterwards, gently rub the area to aid absorption. After administering adrenaline, the person should remain where they are and should not be allowed to stand or walk, as this can worsen their condition. Even if symptoms begin to improve, the emergency services should still be called. When emergency services arrive, provide them with any used auto-injectors. This allows them to dispose of the devices safely and ensures they know exactly what treatment has already been given.